So today is our final day, and we are lucky to have four experts from all over the world. We have 3 online and 1 in person. So let me quickly, briefly introduce each one of them. But today the topic of the panel discussion is how should health modeling evolve in the era of AI? And we discussed a lot of things, and today I think we will be hearing from top-notch researchers. They are really expert. You will hear in few minutes what they have to say. They have a huge amount of experience, and in spite of my last-minute request, they said okay for participating in it. So we are really grateful, all of you guys, to be here. And so the first panelist is Dr. Fani Viranki. He's executive at Optum, and he's running some US team, India team, and he work on global projects. So actually, once I will introduce briefly, I will also let them describe their trajectory and talk about their background. And the second panelist is Dr. Sherry Towell. She was my colleague at Arizona State University. She was a faculty there. I was a faculty at the same time. But since then, she has been globally known for her research. She had a website, I don't know if it is still working, Dr. Towers, but it is still working. She's giving thumbs up. And so you look for sherrytowers.com. And she might tell a little bit more about it. Amazing researcher. And also we have Dr. Sudeepa Chauhan. She is an excellent researcher, mathematical background, but right now she's working with modeling group at Thermo Fisher, which is, she's in Canada right now. By the way, it's very evening for them, and so it's really they are using their family time to be with us. So thank you very much, all of the panelists, to be here. And Dr. Dharmendra Tripathi will be joining in few minutes. He had some emergency last minute, so he will be joining very soon. So if we maybe we can start with a brief introduction, and if you can talk about a little of your trajectory to where you are today, and what modeling role has you have played in a different aspect. So that would be wonderful. So maybe may I invite Dr. Fani first?
Okay, so I'll go first. So Fani Viranki by name. So as Dr. Mobai mentioned, so I am a leadership team member of the Optum Life Sciences. So we are based in Eden Prairie, Minnesota, but I work from a Houston office in Texas. So we also have an India team based out of in New Delhi and Hyderabad and Bangalore as well. So from a trajectory perspective, I'm a clinician by training, trained pulmonary critical care physician. So did my entire medical college schooling back home in India in Hyderabad, and followed by when I moved back in US almost like 2 decades ago. Did my own practice, joined faculty as well, had my own shop in academia, ran NIH clinical trials funded by NIH, which is like National Institute of Health. So it's one of the leading organizations that funds basically it funds many programs. So I was designing clinical trials. Eventually I got into real world evidence as well. So which means how do you use the data and pretty much massage the data into this healthcare outcomes research. So went back to do my PhD in epidemiology and statistics, followed by a fellowship at Vanderbilt Medical Center in health outcomes research. So was a faculty, a clinician, and also a consultant. So right now I work for Optum, which is United Health Group. Basically, it's one of the healthcare sector of United Health Group. So, which is one of the largest or 40th or 5th company in the globe related to healthcare. So which means United Health Group also is a payer, so which means the insurance company, so which has its own members, and it also has its own pharmacy, which is called Optum RX, and it also has its own clinics, which is called Optum Health Clinics. So which means that we have pretty much covered the entire healthcare systems all the way how the patient enters into the system, gets treated, and billed by an insurance company, and claims processed and given back. So there is data moving around the entire ecosystem of the healthcare that actually had a good chance to witness the entire movement of the data when a patient enters a hospital's healthcare system and then discharged, and manage thoroughly. So from a trajectory perspective, as I said, a clinician and a consultant. Right now, we have a team of almost close to 100 to 150 folks working exclusively, generating real-world evidence to support drug development and pretty much drug commercialization as well. So I'll speak more about how we use different models and everything. And as you know, the new language is all AI, but we have been using the machine learning methods, several models since several decades. But even though the fancy terms have been coming up these days, but we have always been using models in day-to-day activities. So I'll speak more about it in the next few minutes. But I'll just pass it on to Dr. Chauhan next. Oh, sorry, Dr. Towers, because I know Dr. Anuj called first, me followed by Dr. Towers and Dr. Chauhan. So my apologies. I'll pass it on to Dr. Towers.
Hi there. I'm. As Professor Anuj mentioned, he and I were faculty colleagues together and good friends when we were both at Arizona State University. So I have a very odd career path that led me to what I do today. I actually have a PhD in particle physics, and when I was in particle physics, actually multivariate methods, including artificial intelligence methods, neural networks and whatnot for event classification was one of my specialties in particle physics. In particle physics, you also do a lot of modeling, and both statistical and mathematical modeling of what's going on. And when I went back to school to get my data science degree, I discovered that I had this toolbox of skills that was remarkably useful in modeling of disease, spread of disease. So I became basically my field of research for many years was modeling infectious disease. Around 2014, 2015, Professor Mubay was actually one of the co-authors on that paper. I started to look into modeling human behaviors as a contagious process, with particular focus on violence, but not completely just violence. And so that became a research focus for quite a while. I have consulted for years. I've been a data science consultant for years. And particularly in the last 5 years, I've been exclusively a data science consultant for a variety of partners, primarily looking at topics in public health and epidemiology. Not just violence, I actually was consulting for the Disney Corporation back in 2020, modeling the spread of COVID on their leisure properties. So I still do disease from time to time. These days, I most recently was consulting for University of Ottawa, looking at approaches to reduce child bullying, which is a universal problem. Regardless of culture, there's problems with child bullying. And we actually were developing a prototype. Has everybody heard about Blue Sky, which is the alternative to Twitter? We developed a front end to it called Clear Sky, which used AI tools. We developed AI tools that would filter the content so that even if people were making negative comments, it would filter it such that the gist of the comment would be maintained, but it was worded more kindly. And actually, we set the AI such that it could also make it funny. So we had various settings that we could use where it could also make it amusing. But it basically turned down the temperature of the discourse that would occur on the platform. So we never got beyond it still could potentially go somewhere. But we did have a working prototype for that. I also use AI in my own life. one of the things I've always wanted to do for both my clients and also for myself is the ability to develop apps for smartphones and tablets. And I basically use AI to help me learn much faster than I would have on my own, because I'm certainly capable of learning that on my own, but it was much faster with the assistance of AI. So I use AI as a tool in my own life, but from both my research and my use of AI as a tool, I'm aware that it can be very powerful as a tool, but it also has many pitfalls. And I think that's one of the things that we're going to be talking about in this panel, if I understood Professor Mubai correctly. All right, so I'll pass it on to Dr. Chauhan. Did I pronounce your name correctly?
Yeah. Thanks, Sherry. So hello everyone. So myself, Dr. Sudeepa Chauhan. I'm based in Ottawa, Canada. So when Sherry was talking about these other things, and today only I was talking with my son about bullying and all this stuff. So yeah, so I'm looking forward for these things, if I can come across on this, and how do they bully in the school or something like that. So yeah, that's a great, interesting topic which you were sharing right now. So talking about my background, like I'm an applied mathematician. So my trajectory is something like I did my PhD in applied mathematics back from my home country, guided few PhD students over there, and then I moved to Canada, and then I switched into an industrial job. So I was with Institute of Health Economics for a while, where I was doing economic evaluations of various medical devices over there. So it was related to neurology and several other rare diseases in those, like Fabry diseases and those, and how the apps have been formed and how it can be cost effective in terms of using these apps instead of using the medication. So those are some of the interesting topics I worked upon. So currently I'm working with Thermo Fisher Scientific, and we are working on some cutting edge problems. So to mention some current problems which I'm working on right now is related to oncology, and especially we are working on prostate cancers right now. So different type of models in this. My journey for my background in applied mathematics is actually helping me a lot in the way that how you can relate those models and how you can develop those models in terms of what the industry is demanding right now, and the way the structuring can be there, how the clinicians can be helpful in this, and how the inputs can be used in a different way so that we can come up with a model which is relatable and which is appropriate as per the disease progression which we are talking about. So currently the prostate cancer and also some of the rare diseases which I'm working on. So this is a small background on myself.
Thank
Over to
you.
Mugai.
Yeah, thank you, Dr. Chauhan. And also we have Amit Tripathi. You all have heard him for last few days. But I think what you want to know is background. I mean, the trajectory he followed. And there was he's very well known and he's very active researcher. I don't know if you are aware of, but we know internationally. Definitely people know it domestically. So, Dr.
So thank you, Dr. Dhanush. Hello everyone, and welcome to the 5th day of the Gyan program and this very interesting panel discussion. Regarding my trajectory, myself, Dharmendra Tripathi, and I completed my UG and PG from well-known university, Banaras Hindu University, Varanasi, and then I completed my PhD from IIT BHU. Then I did postdoc from IIT Kharagpur. I joined various institutes like BITS Pilani, Hyderabad, IIT Ropar, then IIT Delhi, then IIT Uttarakhand, and now I am working as an associate professor in Department of Mathematics in IIT Uttarakhand. And my research areas are, I am working in basically biofluid flow modeling and various type of physiological system and phenomena I used to model by using the various conservation principle and looking what type of trajectory for the blood flow, urine flow, and esophageal movement, intestinal movement, and what type of bacteria or any diseases inside that, how we can control their trajectory or movement inside the fluid flow. And also we are working on the bone mechanics, what type of materials are there inside, and what type of physical properties they have, and how they are affecting to the flow analysis or transport phenomena. So we are trying to do the analysis of such type of transport phenomena. And some industrial fluid flow problem we are also working, like diffusing flow and various type of pumping process, and how much pressure is required for any particular fluid flow. We are analyzing and providing the different type of design of the pumps from the mathematical expression. So all those things are very important to control the different type of physiological flows inside the body, and how we can think if there is obstruction or there is a problem inside in the transport phenomena, how we can provide external forces to control such type of transport phenomena. So these are the very interesting research areas where we are looking and working on that. So thank you very much, and thanks to Anuj for considering me as a panelist in this panel. Thank you.
Thank you, Dr. Tripathi. So now you all know the background of, so it is from the clinical science to medical devices, to social phenomena, to engineering work, to fluid dynamics aspect. So there's a whole spectrum of places where the modeling applications have been there. That's the one gist of it from the, also they have worked on variety of problems, all of them. So with that, I don't want to waste much time, and I want to start with a few questions that I have developed to, because that would be really helpful to our participant here. And so let me ask, and start the group discussion. The first question I wanted to ask with all of you, maybe anyone can take a lead on it, is how are these health modeling evolving in the AI era? I mean, are we really taking it specific, clear pieces of AI incorporated in the process of modeling, or we are not yet ready to incorporate even a slightest bit, in a practical sense, in a real sense, in a finally, when we work in industry or when we work in academia, what portion, are we using it informally or formally? So, and the question can go to anyone. So maybe Dr. Fani want to take a lead on this?
Yeah, sure. So let me start with this high-level statement. So on the healthcare sector, so when I talk about healthcare sector, just putting the public health away, just talking at the patient level, disease diagnosis and management. So before we talk about public health, so because of the public health side, again it's like epidemiology and public health is completely different. So at the patient level, so there are something called clinical workflows. So typically on the US side, there are clinical workflow which are incorporated in the EMR system, so which is like an electronic medical care system. So for instance, in India, if you go to any corporate hospital, they keep entering your medical recording system. So they do have an EMR system, but it's not the clinically directed workflows. So that something is automated on the US side, unlike in India. So India is catching up, but it's not there yet. So which means, so every patient is managed as per a guideline. So which means those are the workflows that are automated. So which means there are several predictive models that are being run behind that workflows to inform that a patient has a probability of a certain condition based on these all symptoms and labs and everything. So which means there's a model behind that workflow. So those are all well incorporated, and those systems are getting automated and pretty much across the entire healthcare system. So even though unlike in India, US is very structured healthcare system. So there are really large healthcare EMR healthcare systems that are having a data structure like Epic server. We call them as different. So at the patient level, there is a reasonably formal way of incorporating models into practical way of disease diagnosis and management. That being said, on the India side, where where the entire healthcare system is fragmented, because you just, for example, you feel having some signs and symptoms, you can go to any hospital that is nearby, or if you have a specialist that you know or you believe that a specialist is able to diagnose it, you just go. So which means that the provider or doctor will treat you based on your signs and symptoms, and he will enter into his healthcare system. But that healthcare system is not connected whenever you come back for the next visit to somebody else. So it's all fragmented healthcare system in India. So that makes it really challenging to incorporate everything at a patient level. That being said, let's move from patient level to an epidemiological level and public health level. So basically it's an ecological base. So on the public health or epidemiology perspective, so there are some large public health institutes like Center for Disease Control and Prevention in the US that pretty much tracks most of the conditions, especially infectious diseases. So if there's any outbreak, I know Dr. Mubai and Dr. Kavos might have worked on several infectious disease models for CDC and even Public Health Agency of US and everyone. So there are institutes that actually rely on different models and establish surveillance systems, and also some of the larger prediction models, so which means that data feeds keep coming on a daily basis, including signs, symptoms, zip code, county level, lab tests at every patient, at every city, at every county. Think about putting about the same thing. So if you are a patient that had some kind of signs and symptoms of some COVID or flu somewhere in a small district in Uttarakhand or somewhere, that data point will be captured right away, and there are several time parameters that data point has to be fed into the surveillance systems within 24 hours or 48 hours. And those prediction models keep running on those data points and develop those and provide some guidance to epidemiologists or public health specialists whether there's an outbreak or not. So going back to Dr. Mubai's question, so yes, formally there are healthcare models that are formally established at a larger scale in the US. Can they be established in India? Yes, but it needs a lot of effort and resources and guidance. But the way things are established on the US side, it's like takes several decades to evolve here. And I'm giving you a few examples, but I know there are so many things that I can just chat, but I'll stop here so that I can just pass it on to Dr. Kavas and Dr. Chauhan on the call from their experiences.
Please.
Yeah, I would like to add something. Like, I agree with the things which Dr. Pani said. So since now I'm working in oncology, so yes, we have some structured NCNN guidelines where we have the cancer type along with the system, along with the symptoms and signs. So being an applied mathematician, if you are going to structure a model, so you have those reference points which can help you to divide, because many of you may be working in the dynamical transmission models, something like compartment models, so you have those signs which can help you to structure a proper relevant model structure. Along with that, when you are talking about in terms of patient level, so you know that at which particular health stage you have to apply which kind of drug, and if you are moving up to a metastatic stage, to a higher stage of cancer, then what are the options for the drugs which should be incorporated in those states. So that's more relevant in terms of, because you have those references over there which can help you out to bifurcate into an ideal compartments, or the stratification is done in a better way instead of that which we are having right now in India, which we are lacking right now. Yeah.
So there, are we using any AI tools to stratify the compartments? Is that what you're saying?
No, if this is something like I'm talking about the way the symptoms and the structures, like for example, if I'm talking for example of a prostate cancer right now, so we have several stages in this. So when we have those NCN guidelines where we are talking about the symptoms, so we know that if any person is having these particular symptoms, so he or she is going to be in this particular health state. So that gives you a proper reference when you are developing a model. So I'm making it a point that how you can structure the model in a better way in terms of randomly just creating a simple model, which generally in infectious models people do also, like They simply talk about ACIR model, SIR model, but there can be some bifurcations in those compartments as well, in those as per the guidelines which we have here, in like US and Canada now. Yeah.
Thank you. Dr. Thomas, what is your view on this? Automation, which any automation that has been done from a modeling perspective and people are formally using it?
So I can't comment on, like I have not used AI to develop models myself. But I do have a very long background in use of AI. And one of the things that I think an important thing to realize as you are a researcher beginning to explore the use of AI as a tool in your research, there are many pitfalls. So while these tools can be very useful, for example, I think you were talking about prostate cancer, what AI can do very, very well is basically go out, and it does it within seconds. It's actually amazing. It can go out and it can basically do the background reading on a topic and summarize for you in ways, the information that would take you as a researcher hours, if not longer, to actually try to amalgamate that information and use it towards creating a model that is a better description of reality than, say, some simple SIR model or something like this. Because at the end of the day, what we want are models that are just complicated enough to actually encapsulate what the true dynamics are of interest, that you can then use that model in a useful way to guide treatment or whatever, or forecasting. It could be forecasting. What you don't want is something that is unnecessarily complicated. And one of the problems that I have, so I have a background in AI, I know what's going on under the hood, but at the same time, I'm very suspicious of AI. So I use AI myself a lot, I do, but it has a lot of pitfalls, and I come across those pitfalls. Now, I am an experienced enough researcher, I've been doing this kind of thing for years, that I am able to detect when the AI is feeding me garbage. And I'm able to push back against the AI. And sometimes the AI, these models, sometimes it'll double down. You tell it, no, I don't think that's correct. And sometimes it will say, no, what I said was true. And you push back with like a reference in hand saying, no, this paper says that is not correct. And then often the AI will back down. It's like, oh, you were correct. You were right. I was wrong. You were right. I was wrong. Here's what the answer should be. And it could be like you're trying to develop a model, a better model. And so then under your guidance, with you inputting your own, you realize that it was giving you garbage, and you push it, and then you can get something better out of it in the end. But you have to proceed with caution. So just because AI tells you that something is a better model for something doesn't necessarily mean that's the case. So don't ever use AI as a crutch. You have to understand deeply what it is you're trying to model, what it is you're trying to achieve, what the important dynamics are that you're trying to encapsulate in that model. So it could be for disease, it could be human behaviors, it could be for, whatever. What is it that you really need that model to do? And you have to make sure that you as the researcher have done the background reading that you can detect when that AI is giving you garbage. Because the AI does give you a lot of garbage. This is not an infrequent thing. So while I have not used AI for model development myself, if I were to do that, I would proceed with caution. So I think if I have one message to all of you, it's that is very useful tool, but it can go very badly wrong if you just rely on it and you have not done your due diligence as a researcher to know what exactly you're trying to get out of it.
Thank you, Dr. Oz. Dr. Tripathi, have you used any AI tools formally?
I'm not using AI tool, but I'm thinking how we can control the flow analysis through the AI tools, because we are learning various tools to solve the set of partial differential equation. But I do agree with Dr. Towers that the advantage and disadvantage of every technology tools are there. So the AI can be controlled. AI can be controlled always from the NI, natural intelligence, because artificial intelligence has various advantages and it is very fast. And automation, if I can give the example of Indian hospitals, and the number of patients are very large amount, and in hospital only the medical experts are there, and sometimes what we are feeling that many instruments are there based on the various technology, but skilled people are not there to handle those things. So if they are in the hospital, if skilled people are, when we are thinking about the AI based automation in the hospital of Indian system, we should think that how we can integrate the AI engineers or AI skilled people with the medical person, so that they can help how they can easily handle. Because controlling is very important when we are thinking about the automation of any system. So this is my view, I think.
This is awesome. Actually, what I got as a summary from the discussion is Dr. Fani was mentioning about US and India. There is a distinction. In US, there are automations that they are doing from, for example, using clinical raw data to something where they can use it and that is happening in a formal way. Dr. Chauhan was mentioning about there are guidelines, standard guidelines, to finding those guidelines and using it in the model component, at least in her field, is that is to the extent they are using. And Dr. Tower was mentioning about, it is being used as information gathering exercise, but not as a blindly, rather you need a human judgment to make sure that the information that you are getting is correct. And Dr. Tripathi was actually talking about practical issues in India, which is existing systems is slow because of so many patients on hand, and therefore there is a process is needed to integrate. The integration process is important because not everyone is skilled enough to use it immediately, even though you will put that system in place right away. So these are very important critical views. It's not like a black box things and you can just close your eyes and use it for your modeling purpose. So having said that, I want to these are very important points, but I think this also sums it to what is the skills needed for us to be, as an early career researcher, in the modeling to focus on from an AI perspective, or we keep on doing the same way skills gathering as we traditionally have been doing for last few decades, for example. So what are the skills that are changing right now in the AI era, if any, or there is no need to change? And this is open question to all four of you guys.
So I'll start off just like so from a healthcare model. So as Dr. Chauhan mentioned, you need a reference point. So to start with, so that reference point is something that you can easily get it through AI. So as Dr. Towers mentioned, yeah, as long as you write a proper prompt to an AI, either it can be a Grok or Copilot or GitHub or anything, so it will provide you some of the reference points right away. So rather than just you need to go and find them clearly from different websites or anything. So where we are in the drug development and commercialization, let me start, because that's where my area has been mostly about the patient perspective as a clinician and epidemiologist. So to bring any new drug in the market, the biggest thing that any approver on the US side, which is primarily the FDA, usually not only requires the clinical efficacy of a drug, so which means is a drug able to reduce the disease condition by a certain point compared to a placebo effect, compared to a placebo, which is called clinical efficacy. And the second thing is like whether the drug is cost effective. So that's the biggest thing that they usually try to demonstrate. So any pharma company, so right now they're called as health technology developers because pharma companies or life science companies, so they have to submit a report on the cost effectiveness of a drug. To develop cost effectiveness is a model, so it's an so you need inputs to a model. So that's where right now, using AI, some of those inputs have become easier to gather the information from literature. So previously, we used to reach out to several clinical leaders and scientific medical experts and used to do a thorough systematic literature review, so that usually takes like 4 to 6 months. So now there are some good AI tools. For example, nested knowledge is one of the most popular tools that is and based out of US, Denver. So there is one more evidence synthesis tool based out of Chandigarh in India, so it's called ECSLR tool. So these are like AI-based evidence synthesis tools that actually synthesize some of this literature really quick and put them all into the structure of a systematic literature review, which basically is like a PCOS criteria and everything, and try to gather the inputs which are needed for that model. So that's where we have been using AI from the drug development and commercialization. So for commercialization, again, there are so many things that we have been using AI. For example, we develop, especially at Optum Life Sciences at United Healthcare, there are so many predictive models that we have developed, so which means once a drug is in the market, so we would love to make sure that some of these high value patients, so which means a patient that has significant burden to the healthcare system, receive those drugs right away. So which means we have to, so using our existing data and data feeds that come in on a daily basis, so we run several models and develop several AI-based platforms that actually predict the potential patient that is needing this drug and everything. So again, it's the same thing. So where do we use AI? So again, going back to what Dr. Powers mentioned, so it is the right way of gathering the information, synthesizing the information for a model development. So, but we use AI across the entire drug development and commercialization primarily at United Healthcare. So there are so many things that we do with AI, but primarily I was involved in drug development. So that's the reason I can confidently say where we use AI, where we do not use AI, where there are several situations where some of these models have provided a negative result, but still we as scientists have if from my perspective, where I see everything from AI or models or everything is like I always go back to my AP101. So textbook of like Bradford Hill's criteria. I don't know if you guys have heard about this. So there are like the 9 conditions where you need to establish a relationship between human infectious disease and behavior. So in that, the Bradford Hill's criteria, AI can only demonstrate consistency and specificity of any relationship between a disease agent or a behavior and disease outcome, but it cannot establish the causal relationship. AI is not a tool that says to you that drinking excessive coffee will lead to some cancer. It's not a tool. So it's the interpretation of a researcher that generates evidence or uses evidence generated by an AI to make that evidence. So but I'll stop here, but I always go back to the Bradford Hill's criteria from my AP101 lesson like that. I learned like 25 years ago. So if you go back and reread those 9 criteria from the HILS criteria, you will really understand where AI can help you with which criteria between the human disease and infectious agent and behavior often for an environment. Because you have the triangle in where disease, host, and environment interact together for disease outcome. So if you go back to that criteria and try to understand, so there are some key criteria that AI will never be able to replace it. So which is biological plausibility and always a causal relationship.
So thank you, Dr. Beranki. So basically what you are saying is use of certain tools like SLR tools, for example, how effectively to use, those are the skill set, knowing the methods of SLR. SLR is a systematic literature review, and also interpreting what the inputs you are using in the model correctly for you, which is useful for you, because sometimes AI can give a lot more information than what is key for you, or may give you a different information than what you are looking for. So that interpreting the input, if I'm not wrong, this is exactly what you were referring to. Yeah.
That is correct. So since we're all discussing prostate cancer, so I'll give you some classic examples. So there are some key drugs that are already available in the market for prostate cancer. So when you talk about prostate, again, the biggest criteria that will define it is stratifying a patient into different stages of prostate cancer is the Gleason score, and the type of prostate cancer, the cancerous cell involvement. So there are already drugs that are able to treat the late stage cancer treatments, and you see that every time when you talk about cancer drugs and everything like PDI inhibitors or PDL1 inhibitors, so there's always survival probability increased by 3 years, 5 years, and everything. But if you go back to understand where now the new research is focusing on is not the late stage cancer. So we are trying to understand how can we prevent a patient to progress even to the late stage cancer. So which means that now your disease population is not all prostate cancer patients. Now it is early prostate cancer patients or benign prostate hypertrophy patients who are about or at risk of developing the cancer later on in their lives when they started 45 years and they eventually progress on. So that's where you need to carefully evaluate your patient population, subtypes, and now the literature that has been there out for several decades regarding all types of prostate cancer is useless. Because now you need early stage prostate cancer, and that's where the input. So again, as Dr. Chauhan mentioned, Dr. Kaus mentioned, so AI will give you so much crap sometimes. It is very important for you to try to conceptualize your question and try to understand how do you just get rid of it, so much literature out there, all the nonsense, and just try to come up with narrow it down to an extent that you can pick the inputs for your model development.
Thank you, Dr. Beranki. Dr. Towers, you want to add? Dr. Chauhan? And Dr. Tripathi?
I think he said also, I agree on that. Like, I also don't recommend that whenever you are talking for any kind of model development, I don't think using AI is the best practice, means it can give you garbage sometimes. So, to understand the disease dynamics, to read the literature, and to summarize it, for those things you can easily go for AI tools, but for developing a model you should know, and sometimes I've seen people when they are putting their prompts, so they are not accurate enough, that they are narrowing it down to a proper research question, because sometimes it's not clear in their head as well. So they randomly put the questions and they come across garbage things which are not useful for them. So that's very, very important, the way it has been structured, how sequentially you are prompting your questions, and it should be clear in your mind to get into that. Yeah.
So what you are mentioning is a significant human judgment along with brief of some AI-induced tool. That is a skill set.
Yes.
So you still need that traditional modeling, human judgment aspects which are key for a significant portion. Then relying maybe more than 50% on the AI tools, for example. right? Is that?
Yes.
Well, I am making up the numbers, but
Yeah.
So, Dr. Towers, what do you have to say on this? The skill set needed for the modelers.
So before I go any further, I have a hard stop at the bottom of the hour, so if I disappear, that's why, and thank you for having me. But I think that is it students who are in the audience? Is it primarily students?
Yes, students and early career researchers, yes.
Okay, so in your early career, what I would recommend is not to use AI, use AI very sparingly. Because the risk is that you never learn how to information gather properly on your own. And I think that information gathering is a skill that we don't take courses for when we're going through university, but I wish that there were courses for it. Because when I was faculty, teaching the students who were in my classes and the students who I mentored, how to information gather, it's not something that is an automatic thing that people just know how to do. It is a learned skill, and you generally learn how to be good at it through people who mentor you, who when you try information gathering, they look at what you gathered and then can give you feedback on that. So AI can also do information gathering for you. But when you rely on AI to do that, it becomes a crutch, and you never, as a researcher, develop that very critical skill that you really do need in order to be good at what you do. So while AI is wonderful, has or can be wonderful, it does have these pitfalls that it can make us dumber if we rely on it too much. So what I would recommend as young career researchers is to learn how to do it without AI before you start using AI. So rather than using AI as training wheels to get you going, instead learn to ride that bike without using AI, and then once you learn how to ride that bike without using AI, you can start using AI to really up your game, to make you faster, more efficient, and better at what you do. But you will not be a good researcher if you rely on AI too early on in the game.
Thank you. That's a wonderful advice. So, Dr. Towers, you have another 3 minutes. Is that what time? Yeah. So, Dr. Tripathi, what do you have to say about skills?
Thanks. I think in addition to Dr. Towers, I can also give the example of ChatGPT, especially for the education system, even for the administration also. Like when we need to gather the information, and we are not, sometimes we are very confused that what we have to do, what we have to not do, and in the very short time. So these tools are very helpful to see the different type of options and the information. I can give on dropping of the any agenda points or any letters to the different type of system. So sometimes if you are not finding out what type of letters or what type of drops we have to prepare, or even for the manuscript or code, if we are not able to understand, but we have to complete those tasks within the time frame. So I think ChatGPT, even sometimes for finding the different type of questions and preparing the lecture notes for the teaching purpose and for information purpose, these AI tools are very important. But we should not believe and we should not copy as exactly what they are giving. So if we have the knowledge, basic knowledge, we can smartly think about what type of contents we should keep, and so we can rewrite those things, and we can. So for taking the information from the AI tools are very important, but copying the exact content, it is not a good practice.
Thank you, Dr. Tripathi. I think with the time constraint, I know Dr. Tower has to go. So I mean, let's thanks Dr. Towers, and we will continue with the panel discussion for a few more minutes. I want to take some questions from the audience, and if Dr. Towers, it is okay with you to stay, you are more than welcome. But thank you, Dr. Towers, for being here. Let's give her a round of applause.
Thanks very much.
Sure. So what we will do now is we will take some questions, quick questions from the all of you, and if you have anyone has a questions for our panelists. Yep, go ahead. Loud.
First question is that in India, I am Sudhanshu from JNU, first year PhD student. So I am seeing many tools, AI tools, but I have not seen AI guidelines for incorporating these things. I don't know in Canada and US it is there in research, AI guidelines. What should be, because it is very important when you are, because we study research ethics and methodology, so they talk about the research ethics. So sometimes, because AI tools are give very excellent, sometimes they are very poor for our expectation, and sometimes they are above the limit for our expectation.
So the question is, if I can repeat, is there any guidelines for the people to, for researchers on AI to go along with the guidelines to do the work, or is it still informal?
So again, this is very broad question. So when you talk about research, so the research can be multiple things. So when you talk about the AI, so right now AI is everywhere. So trust me. So every society or every body has come up with its own guidelines to AI use. For instance, if you talk about manuscript writing, for example, which you can quickly use AI for writing manuscripts. So if you can give a proper prompt to an AI and a ChatGPT Copilot, sure, it will give you a 3,000 word beautiful article with all the reference and everything. So I'll trust me, even though it's not a great article because again it leads to plagiarism and everything, but it will still give you, because I was asked to write a book chapter and I was just writing some prompts and everything. I was surprised to see that AI is learning the way that it's asking me my next step. So it's literally reading my brain and everything. So coming back to the question of guidance, so your question is very broad, but coming back, if you're talking about like manuscript submission or doing research perspective, right now most of the leading journals in healthcare sector have put some statements around AI use in conducting the study and AI use in manuscript development. So you need to respond appropriately, and if you do not respond, there is a chance that it will be, let's say like you say like everything I don't use AI, but you did use AI, and eventually few years down the line it's one of the landmark paper and somebody is trying to replicate the paper, because right now research has to be reproducible as well. And if you cannot reproduce or provide your codes in GitHub or anything, then it leads to a several black mark on your career and also leads to retraction of paper. So right now the guidelines are established by individual societies, because there is nothing like a broader society that says like for every research has to be done this way, because research can be done multiple ways. So again, there's a protocol driven research which we all do traditionally. There's not protocol driven research as well. Again, in literature review or evidence synthesis, there's a systematic literature review, there's targeted literature review, there's a free text analysis. So research can go multiple ways. But if your question is more about simple protocol-driven study, and if you are using any AI tool, you need to report it eventually. So the guidelines have started asking specifically, because I serve as a reviewer and a couple of co-editors, a couple of journals. So the guidelines clearly state that where did you use AI? Either did you use AI for protocol writing, code development, analysis, or manuscript writing? You need to check So there are some, but how do you use AI? Again, going back to the broader question, so there's no specific guidelines. So right now, honestly speaking, so you can just use any tool, because even, for example, think about you're using Open Chat GPT. So you can just purchase a Chat GPT for a monthly subscription. But remember, if your prompts are not secured enough, it's out there. It's out there. Somebody has stolen your idea as well. So within United Healthcare, on the US side where I work, so our entire AI is about secure system. So which means the prompt that I write cannot be seen by Sudeepa or Dr. Anuj. So they don't know what I'm working on, what I'm writing to the AI. That being said, even my fellow colleagues wouldn't know it. So that's the way that, so we have our own guidelines, the way we use AI for, but there are no broader guidelines. Right now we are at a point that AI is giving you everything, but it is the onus of the researcher to take what is important from the research. So again, you have to, if you give me like specific question like, I'm working on so and so things, can you help me, which societies have developed these guidelines? Then I can point you out. But right now there are no broader guidelines in the usage of AI into any research section. But reporting of AI is a must and mandatory for most of the journals these days.
Yeah. So basically what you are saying is for Google search, there is a guidelines? No, there is no guidelines. But what he's saying is, but if you want to write a manuscript, we did talk about the Cheers guidelines, remember? The other guidelines that we were talking about, there are existing guidelines. So it depends on what you want to do. For productivity on a daily basis, probably there is none, right? And there will not be probably. So Dr. Tripathi, Dr. Chauhan, want to add anything to this?
Actually, my opinion is also same as Dr. Fani told, but in various systems where intelligence is being used, like in army or where intelligence are many some important information which should not be disclosed. So there are some standard guidelines, but for research purpose, I don't think there is a standard guideline. But if the misuse of this AI tools will be increasing day to day, I think there will be some more guidelines, because guidelines are coming when the misuses are, is coming in the system. Now it is any beginning level and everywhere they are using to learn the things and gathering the information. So I don't think any guidelines are required. But when misuses will come, then like for the manuscript also, many journals they are giving the plagiarism report that these contents are taken from the AI tools. So how much contents, if everything will be taken from the AI, so there is no way to write the manuscript from the researcher. So if that level, I think the percentage of the level will be increased, I think the guideline will come. So this is my opinion.
Thank you. Dr. Chauhan, do you want to add something to it?
Yeah, I have the same opinion, but like in a general way, I think it's more about imbibing it as a habit, which generally nowadays the early researchers are doing. So I can give a very small example, like here, like my son is in high school, it starts from like 7th and 8th standard itself. You're writing anything, they want you to quote if you have used AI anywhere, and the plagiarism checks. So that naturally gets imbibed in it, and they know that this is the way it has to be done. But when you are in a habit of using for each and everything, like which generally people do, like in ChatGPT when you're writing a manuscript, so it's also stopping your critical thinking, which I feel, and later on, like it's not going to give you a benefit on those grounds. So I think for early researchers, I strongly recommend minimalistic use only of AI wherever it's required. And they should be reading more instead of that. Yeah.
Thank you, Dr. Chauhan. So, any more questions?
Can I add to this question?
Maybe we'll ask someone else, but if there is no question, then we'll come back to you. Anyone else? is a part of your exam too, by the way. No? Okay, go ahead. You want to ask?
Just ask.
I'll interpret it. Yeah.
Actually, Dr. Pani was talking about the progression of cancer, if I understood it correctly. Dr. Pani, you were talking about the progression of cancer. People are now interested in that, and a new research is required, new literature is required, something like that, what I understood. So, do you think this machine learning and AI methods, not tools that we are talking here, can be useful in that kind of progression?
Can you repeat your question?
You were talking about the news that nowadays people are not interested in the late stage cancer.
Oh yeah, yeah.
Progression of cancer. And so new study is required.
Yeah.
So can like ML and AI be useful there?
Yeah, so I think, yeah, let me rephrase what, so I think, Dr. Fani, you made a very good point earlier about the way we are doing research has been changed now also. The way we used to do 10 years, 5 years back is different, and today is different because of AI. Since AI tool is there, he was saying that since AI tool is there, we are now looking not at the stage where the treatment is available, but also at the earlier stages of the cancer where AI tools can do a good job. Am I right? Is that what you were conveying in the point? Or something else?
No, so that's one more thing. So you have to be careful. So AI would not, or right now, the 2025, end of 2025, AI does not have the capability of identifying novel pathogens or novel biomarkers where a disease can be developed. That being said, there are life science companies that are pretty much, like they're pretty much a startup stage, that they are using the existing data to help AI recognize new biomarkers or novel, what do you call it, pathogens or anything. So right now AI is not there yet. So my point I was trying to make earlier was, so for example, you read anyone, I don't know if you are public health, epidemiology, say health informatics, whichever course are you in, the classic example that we have been reading is like smoking leads to lung cancer. Whatever, that's a classic example. Now, nobody, any researcher, any scientist, you don't have to demonstrate or prove that smoking leads to lung cancer. It's already done. It's done and dusted. But if you're going to an extent of saying that some particle within a cigarette smoke or a water pipe or some smokeless tobacco product leads to stage 2A non-small cell lung cancer, then that becomes now a question. So that's where the field has been moving away. So whatever you read in a textbook right now, those are foundations. So everyone are echoing the same thing. So we are trying to say the same thing. So when we have been in your state, sitting out there in front of your professors, trying to understand, we have read those classic textbooks, classic examples, but the field has been changing. So for you to even understand the fields, you need to have the foundation. So to help you frame that question itself, you need to have that understanding of so many things like the foundations of causality, epidemiology, public health and everything, and then use the AI tools. So, but AI is not at the stage to identify novel pathways or novel pathogens as of now. There is a couple of companies, and I don't want to name them, it is too much beyond it, but right now the field of medicine has changed. So right, if you think about like how AI would help me, so say that you have some kind of signs or symptoms. So for example, you're showing signs of tiredness, fatigue, weight loss, and you are feeling some on and off pain in your lower belly, and infrequent urination, red during urine and everything, and you go to a urologist. Okay, so I'm still using the prostate cancer example because I know Sudeepa chose that example for a reason. So it's a classic way because prostate cancer is a very good cancer where you can differentiate between benign prostate hypertrophy and prostate cancer using a nice parameter which is called Gleason score. So you have the signs and symptoms. You go to a neurologist. Think about so you have an AI that is sitting on your data, on a single patient's data, will quickly show the predictive of your ability to develop cancer 3 years down the line. So that's the beauty that AI will give you. Right now, the machine learning model that you don't see it, but your provider will see it. That is the predictive ability of the machine learning or the AI that is sitting behind your data, that is running the predictive model and providing a urologist that so-and-so patient who came with these symptoms in December 2025, they have the probability of having stage 2A prostate cancer like 5 years. So that's the beauty that AI can give you. But that's not available like 10 years ago. That's AI has been now incorporated in clinical workflow. And going back to the NCCN guidelines that is usually followed in the US, so most of the oncologists right now, so okay, now you're diagnosed having a probability of cancer. Now we go back, now the urologist will refer you to an oncologist. Now the oncologist will look into your signs and symptoms. Then there is the same AI that has incorporated NCCN guidelines, and based on the signs and symptoms, it will risk stratify you as a patient with early stage prostate cancer patient and provide you the management straight away. So those workflows are never available like 10 years ago. Of course, they're not even available in India yet. But those are things that are available right now that will help you. So AI is there, but how do you use it and everything is what we have in this discussion here. So for you, if I were you sitting there, I know even like 20 years ago when I was a student, even I was hesitant to ask questions, but you would love to ask questions. So as Dr. Towers mentioned before she left, don't use AI right now. Learn all the foundations, then start using AI. If you are not convinced with my statement, then divide your class into 2 groups. Take one question, do it in a traditional way, do it in an AI way. Then you will understand the difference between AI use study development versus non-AI use. Remember, trust me, the researchers who have developed a study without using AI will gain more knowledge and more experience and ability to, and their comfort level and confidence will be significantly higher than the one who used AI into everything.
Good suggestion. Dr. Tripathi, Dr. Chauhan. Yeah. Okay. So I think it is 20 minutes above the time. So I want to take time for you guys to think about this thing, what has been said here by the panelists, and and talk to also your mentors to see where the trend is going. But the gist of the discussion has been use your foundation first, and then basically use the AI to a minimal level, because otherwise you would be not improving your skill set. That is what is needed when you are not in front of the AI basically. So let's thank all the panelists and give them a round of applause. So thank you Dr. Fani, Dr. Chauhan for joining us remotely in the late evening, and happy holidays to both of you. Dr. Tripathi also, he's here with us, but he's a host actually, and it's a pleasure to see you after some days, and greetings once again.
Okay, thanks for having me, and good luck guys, and have a wonderful rest of the day. Bye everyone.
Bye. Bye. Okay, so I don't know if you guys got some idea here, but the whole story was about that we are not thinking on, we are just using it. without thinking where it is helpful, where we should use it, where we should not use it, what for we should use it, what AI tool you should. Dr. Namka was the other day talking about so many tools and how to judge them where to use it. We have not taken time to pause and think about these aspects. And that is what this panel discussion was talking about. And Dr. Tripathi was mentioning very, very nice things. You know, in US and Canada, things are more sophisticated, more systematic, more organized. It's not that in India it is not organized, but there are so many people, there are so much complex system. We are 1.4 billion population, right? As compared to US and Canada, which are minuscule as compared to this one, right? So the system is more complex here, and it is not easily to incorporate AI so easily. So I think what important things that I have understood from these experts here is that, I mean, not using it blindly, only using it where I need to double check. Once we have our own ideas about certain things, then we can double check to see if it could add on some more information on top of it. So that is my 2 cents of understanding between them, but definitely these are experts. Now you know them, you can always approach them, message them. They would be happy to connect. They are on LinkedIn, they are very well known, by the way. You don't realize they are very humble, they are very, they are, for example, Dr. Fani is heading a department of life science. Optum is a part of United Healthcare Group, which is the largest company in the world. The largest company in the world. I don't know if you are aware of this aspect, and they are doing top-notch research right now. We get to know these research 5 years down the line, which they are doing it currently, and they can't disclose everything. Also, they have their own. So these people have expertise and they have teams who are working purely on AI tools. They are purely modelers. They are purely clinical, and they come together on a same table and discuss on these cutting-edge problems. So that's the best environment where you could have empirical scientists, you could have mathematicians, you could have different type of skill set people sitting on a table and discuss. That's where the innovation happens. And they are part of the latest innovation. And of course that is part because the company is very rich and they are pumping a lot of money for more innovations, and therefore they are doing it. But that's not the point I'm making. I'm saying their skill set and having given us this time is amazingly useful for us. So if you want to connect, you should message, thank them, and you should say what you have learned, and I want to be in touch with you. That is itself makes your network big. And Dr. Towers, she is an amazing researcher. She was publishing all amount 25 papers, and all in Lancet, New England Medical Science Journal. These are very tough journals to get into the papers. And these are quantitative scientists. They are not clinical scientists. Clinical scientists is still easy because you do the experiments and you can publish in these papers. These are medical science papers. And if you are from a different background and publish it in these journals, then that's commendable. As if you are a mathematician and you are published in the medical journals. It is very tough for you because you don't understand fully the language that they speak and the things they do. So what I'm trying to say, these are pioneer. Dr. Tripathi, he's traveling, he's saying tomorrow I'm going somewhere else. He has been going all over the world, he has the connections, and you are lucky to have it here, knowing him. So connect with him, bombard him with the emails, I mean not like junk emails, but useful emails that really truly concern your questions in hand. And I'm sorry I didn't tip your last question, but we can discuss.
You can email. So I will
Yes,
email.
and that's the best way. If you have more questions, and these things, don't be shy. If you want to really build a successful career, network is the way to go forward. Network, and people understand when you are just making the network for the sake of network, when you are genuinely trying to put your effort. When you genuinely try, you do some homework before you reach out to someone. What that means is you get to know the person background by Google, by whatever the websites you, and then you also think about what is a critical question or discussion that I can do with that person and message them, right? Not just randomly, oh, I want to be your friend, right? I mean, people will not mind, but that would give less points to your message. So that's my 2 cents here, and Dr. Patil will want to say a few things or what?
First of all, very good morning to all of you, and welcome to the last day of this Gyan program. And let us have a big round of applause for Dr. Anuj Mobai for structuring the complete this course and bringing the big people as a panelist and the speakers for this Gyan course, because Gyan course basically designed only for 2 or 3 speakers or 2 or 3 instructors. One is from international and one is from host institute, or you can add 1 or 2. But think about that, we thought this Gyan course in very basic way. But after when we started, we every day doing the exercise that what type of contents should be there for tomorrow, and you can see the different schedules he is putting in the group and bringing the different type of people, so that whatever the time he has taken from his schedule and come for you people and trying to give most of the contents and connecting with the bigger people, so that when you go after this course, you should have various skills, and at least you can think in which particular direction you can start and give your contribution to the country or to the society, and even in your family also. If you can think in broader way, and the usage of the various tools, various techniques, technology, because it is not easy. It is not easy when you can, like many panelists, they have told that when you have the traditional knowledge, and the same thing I am suggesting to the students, when you have the basic knowledge, then you can judge whether the tools are giving the correct results or not, whether the tools are predicting the correct results or not. If you don't have a basic knowledge or basic, same thing I was discussing one scientist from the DRDO who is looking or heading the AI department in Bangalore. So he was telling that I am giving the fund to the mathematician only, because we are using blindly AI tools, but we are not thinking that what type of algorithm are working behind this AI. Other numerical tools, we know that what are the steps, what are the algorithm, and what type of code we are writing in different languages and how it is working. So everything we are understanding. But how we are using the AI tools and predicting the results, we are not getting that what are the steps behind that. So he was telling that I am ready to fund a lot of money or use money to the researcher, especially the mathematician, if they can think and find out the best way and the best algorithm that how the AI is working, so that we can control and we can think that AI tools will be useful in the betterment of the society, not sometimes AI will control to the human being. So this is very important, and thanks to the Anuj that he has, I cannot imagine you can experience with this 5 days Gyan course. So let us thank sir for giving your valuable time, and I know we can have the quick 5 minutes break, and we'll come with the question paper for examination. Nice.
But basically we are working with the AI tools. What I have seen in the UPSC, they are not simply using any tools, they are using algorithms. So what the results are, they are based on data, they are using the algorithms. From the lecture, we are discussing about the AI. Basically, they are AI.
Yeah, so so these are not computers. So 90% of the people are not making AI tools itself. They are using the AI tools. 90%. The 10% they are building the AI tools are from computer engineering, computer science, information technology. Those are different set of people. What we are focusing on a use of AI tools.
AI tools, not simply. Are we talking about the LLM or
Well, the behind the scene is all the big data algorithms, right? So behind the scenes, whether you take ChatGPT or you take Canvas or you use any other Notion, they are all using ChatGPT type of LLMs.
they are using, but for the detection, we have the reasoning of different topics.
Right. Yeah.
As the result,
Yeah. So we are not using.
quite confusing AI actual.
Right. So AI tools that is there. So what you are talking about, there are different tools for reading images or reading the videos, right? Or basically different types of data, not necessarily large language model, because large language model is on text, right? But you are talking about maybe some video, other type of data, basically. So, but what we are concerned, most of us are concerned, are the use of already made tool by someone, whether it is in language, whether it is in audio, whether it is in video, or anything. We are not developing the raw model, basically.
Intermediate thing as well. These AI tools are there, and then people are there who are building the AI tools. If I take any research problem and I am collecting a very large data set, I don't know what that data set is. Then I will use the machine learning method, machine learning method, and AI method to make the prediction. There some instance may use the AI tool, which have those algorithms, or then I have to write my own code.
Yeah, I think. Can we talk on a break? Because we are getting short of the time. Sorry for that. Okay, so we'll take the schedule is as follows. We will take a break of 5 minutes, and then we will come back and take an exam for 1 hour, right? And there will be videography also, so make sure that nobody cheats, right? So, and then Sheechand is there. It's an amazing talk that is kept especially for this after the exam, so that you can relax and see actually the importance of applications of the models in a day-to-day life, and truly how the cutting-edge work is being carried out. So, so that's the Sheechand talk. After that, and we go for a lunch after that, and then basically after we come back from the lunch, we will have 10 minutes presentation. I have not forgotten about it, so don't worry about it. So there is a 10 minutes group presentation. So all the group members will come here. Quickly try to, during lunchtime, put it in the PDF or PowerPoint and send it to Ashwini, so that your file is here and you can directly present to everyone. Is everyone has slides? I'm not listening. Yes, that's an answer.
Many of us was discussing yesterday that this program is cancelled. Presentation. Yeah.
But I didn't say that.
Yeah. That's why I was confused.
Yeah, so it is still there. Okay, if you don't have a slide, quickly make it. 3, 4, 10 minutes, how many slides? 4 slides. Almost 4 slides, not more than that, right? And how much time it takes? I mean, you are in AI world, you are talking about AI always. So, but it has to be in your research. It doesn't have to be someone else's, right? So make your own research. So 10 minutes presentation, there are 7 groups, so it will be done within an hour or so. And then we will have some closing remarks by all of us. and a certificate distribution, and then we can enjoy, and you will not see me again. So in the sense that I will not bore you more. So let's take a break, quick break, 2 minutes.